The paroxysmal exertional dyskinesia. Paroxysmal exertional dyskinesia. What is the paroxysmal exertional dyskinesia? The name indicates the paroxysmal exertional. Exertional means they associated with activity. That is exertional is associated with exercise. Exercise. It means that the dyskinesia develop when the patient do exercise, or after the exercise the paroxysmal exertional dyskinesia develop. The legs are most frequently involved. Legs are most frequently involved. Most frequently. Most frequently involved. That is the etiology of the paroxysmal exertional dyskinesia. The etiology is the paroxysmal exertional dyskinesia. This is the genetic disorder. This is the genetic disorder. Genetic disorder. The mutation in the gene called SLC2A1 gene. A1 gene mutation causes the paroxysmal exertional dyskinesia. What is the symptoms for the paroxysmal exertional dyskinesia? Because the paroxysmal exertional dyskinesia is associated with exercise, they develop after the exercise, and the most affected organ is leg. The symptoms of the paroxysmal exertional dyskinesia. There is chorea, ethetosis, dystonia, and the duration of the paroxysmal exertional dyskinesia is they last from minutes to hours after prolonged exercise. After prolonged exercise, they are not present at rest. They are associated with exercise, and the legs are mostly affected. And they are also associated with other diseases like epilepsy, and hemolytic anemia. Hemolytic anemia can also cause the paroxysmal exertional dyskinesia, because when we exercise there is rapid metabolic activity, and there is the hemolytic anemia, there is deficiency, and the paroxysmal exertional dyskinesia occur, that is chorea, ethetosis, dystonia. The other